Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
On today's segment, we have reached the T12 or 12th thoracic vertebrae. T12 is the last of the thoracic vertebrae before we reach the lumbar spine. T12 is positioned between the T11 vertebrae above and the first lumbar vertebrae below. The 12th thoracic vertebrae is unique in that your diaphragm, the muscle that you breathe with, and the last pair of your ribs attached to it. As we have seen on previous segments, the spinal column is now forming the unique S shape as seen from the side. As a whole, your spine serves as the main supportive structure to your skeleton. It must be both strong and flexible. The spine forms a protective bony casing around your spinal cord. Remember, the spinal cord is part of your central nervous system and it travels inside the spinal column. Nerves to your body branch off of the spinal cord and exit between the vertebrae. Today's discussion topic is spinal surgery. Surgery on the spine can be life-saving. Surgery can stabilize a fracture or instability. Surgery is needed to remove pathology such as a tumor or to reduce pressure on the spinal cord or nerves, and it may be needed to correct certain deformities. The problem is that for back pain, surgery of the spine doesn't have a very good track record. Back pain is common. The good news is that only 5% or fewer back pain sufferers are good candidates for surgery. The bad news is that the incidence of spine surgery is still too high and it's increasing. There is a condition known as the failed back surgical syndrome, and it's a growing issue in medicine. Recent studies tell us that up to 50% of people turn out to be the same or worse following spine surgery. These cases have an enormous impact on our healthcare system. Many of these cases end up taking pain medication over the long term, and others develop stress disorders such as clinical depression. Look, spine surgery is costly, it carries risk, it has a high disability rate, and it fails to give proper pain relief in a large number of cases. The best way to combat chronic back pain is through preventive measures. This includes the knowledge and care of bone, joint, nerve, and muscle health throughout your lifetime. Treating spine problems require early intervention using neural and joint manual techniques. Other areas of concern include diet, exercise, posture, lifestyle, and stress management. Some private insurance companies today recommend that a minimum of 3 months of conservative care, including chiropractic spinal manipulation, be done before spinal surgery is even considered. For more information on today's topic, be sure to contact your family chiropractor. I'm Dr. Rick. Remember, your back is important to your daily health. Join us on the next show as we continue our journey down your spine.